So pain in lipedema is occurring primarily because of inflammation. But what is causing the inflammation with lipedema? We don't exactly know. It does not seem to be an autoimmune condition. There definitely is overgrowth of the fat tissue, where the fat is actually duplicating, replicating. It's not just storing more fat, which is a really interesting phenomenon. But there's inflammation too. That inflammation is causing changes in the tissue. It's causing fibrotic nodules, so-called lippy nodules. It's causing increasing fibrosis, which is almost a scar-like change in the tissue. And I would say that the more fibrotic tissue that there is there, the more pain people seem to have with lipedema. When their fat is soft and fluffy and there's less fibrosis, that usually means less inflammation and less pain. So the pain is occurring because of inflammation and then fibrotic changes. Now the interesting thing is, how did the fat get there? This has always perplexed me. I always wondered, how does lipedema fat get to the front part of the calf and ankle area? Because it is unusual to have fat in that area for people that do not have lipedema. How did that get there? Did it migrate from an adjacent area? Well, it's very interesting. The recent studies do seem to support that the lymphatics in capillaries with patients in lipedema are leaky, that there is movement of cells, things we call stem cells, which are precursor cells from the lymphatics, into the tissue outside, and those stem cells develop into mature adipocytes, which are mature fat cells, which then start replicating and duplicating, and then the inflammation happens typically to that. So hopefully that gives you some guidance and answer your question.